Have you ever suffered from persistent infections that refuse to go away? Have popped antibiotics to combat a cold, flu or viral, only to learn that they aren't designed to address such conditions? In 2019, around 1.2 million people died from antibiotic-resistant bacterial infections. This number is only rising each year. The rampant misuse and overuse of antibiotics is leading to a growing health crisis, antibiotic resistance, and the emergence of superbugs, which threaten to kill 10 million people annually by the year 2050. Well, how did we land in such a situation? Welcome to India TV. I'm Pooja Sethi and you're watching Perspective. The World Health Organization calls antimicrobial resistance, AMR, one of the top 10 public health threats to humanity. Antibiotic resistance, a key aspect of AMR, occurs when bacteria become resistant to the drugs designed to kill them, making infections not just harder to treat, but also putting several lives at risk. Superbug is a name given to harmful bacteria that have acquired resistance to one or more of the antibiotics used to treat them. Superbug infections are increasingly being transmitted from one person to another in hospital or healthcare settings. Drug resistance impacts billions of lives across the globe. Globally, 7 lakh people die of drug-resistant diseases each year. Every 3 minutes, a child dies from MDRO-resistant sepsis. In India, the situation is alarming. In 2019, India reported 2.97 lakh deaths attributed to AMR. We lost more people to AMR than TB, diabetes, kidney disease, and maternal and neonatal disorders, as per the Graham report. It is estimated that 2 million Indians will die by 2050 due to drug resistance. But how did we reach this point? Easy availability of over-the-counter antibiotics, poor drug control regulations, and self-prescription have become too common. Shockingly, around 80% of antibiotics are consumed outside the hospitals. Studies show that several healthcare providers often prescribe antibiotics when they are not even required. According to the Center for Disease Control and Prevention, approximately 47 million courses of antibiotics are prescribed annually in the United States alone for infections that don't even need these antibiotics. In India, the situation is no better. The National Center for Disease Control recently found that over half of the nearly 10,000 hospital patients surveyed for a study were given antibiotics to prevent rather than treat the infection. It found that 55% of the patients were prescribed antibiotics as prophylaxis or as a preventive. Only 45% were prescribed antibiotics to treat infections. And only 6% were prescribed the drugs after identifying the specific bacteria. As per the government report, over 50% of antibiotics prescribed in India are those with the potential to cause high antimicrobial resistance. So, can we turn the tide back? Researchers are exploring varied approaches, from developing new antibiotics to combat superbugs, to advancement in diagnostics for quicker response and precise targeting. What can we as individuals do? Avoid antibiotics for viral illnesses. Avoid buying antibiotics without a prescription. Complete full antibiotic course. And most importantly, don't pressurize your doctor into prescribing antibiotics. The World Bank estimates that AMR could result in $1 trillion additional healthcare costs by 2050. As of November 2023, 178 countries developed AMR nation action plans, but only a few have been implemented. Failure to implement the plan to combat the silent pandemic can result in a serious health crisis, So, the next time before you take an antibiotic without proper medical guidance, remember that it can do more harm than good. That's all in this episode of Perspective. Keep watching India TV.